Hello, good morning. I am Dr. Balaji Reddy. We will be doing hysteroscopic polypectomy today. This is a procedure which we are doing for enhancement of your fertility. Polyp is the reason for not having pregnancy. So we are going to remove this polyp. There won't be any cut on your body. We will use a 4 mm tiny telescope that we will introduce through the cervix into the uterus, and we will remove the polyp. And the procedure will be taking 10 to 15 minutes time, and you will be discharged today itself. And from next month onward, we can go ahead with the fertility management. Okay, do you have any doubts or queries regarding today's procedure? Okay, fine. So we are going to start with the hysteroscopy. This is 2.9 mm, very small, tiny hysteroscope, which we are going to use for this patient. So we are entering into the cervix. This is endocervical canal. This is the internal os. From here the uterine cavity proper starts, and we are entering inside the cavity, inside of the uterus, and we are now inspecting the cavity. So this is a polyp which has a wide base. This is the left ostium from where the left fallopian tube starts. This is the right ostium. From here the right fallopian tube starts, and this is the fundus area where the implantation takes place. This is the anterior wall. There is one small polyp on the anterior wall as well, and this is the posterior wall. There are few micro polyps as well on the posterior wall. So there are few patchy hemorrhagic spots you can see here. These are formed because of the inflammation of the endometrium. So she is having probably endometritis, and we are going to remove this polyp which has a wide base. It is 1 by 1 centimeter. With the help of scissor, we can detach the polyp from all around its attachment, and we have not used any dilatation because it's a 2.9 mm telescope. We need to ensure that no portion of the polyp is left behind. So to begin with, we take all around circular incision of the polyp when there is a wide base. Most of the time polyps have pedicle, and it's easy for removing the pediculated polyps, where just we have to go in and cut the pedicle. That will release the polyp from the uterine surface. But here this is a wide base polyp, so we have to use the scissor and we have to cut all around the polyp, and we have to detach it from the base. This is the polyp which is totally separated from the uterine surface. You can take out the polyp using the scissors, or you can use the grasper as well. So like this we can retrieve the polyp, and the polyp has came out. Now we will take care of the micropolyps from the anterior wall has been removed. Now we will go for the micropolyps which are there on the posterior wall. So they are here, and there are multiple micropolyps which are there on the posterior surface. And that's the end of the procedure. It was a very small polyp of 1 by 1 centimeter. It took hardly 5 minutes for us. Also, we have evaluated the cavity, and there is no any major problem in the cavity, and she will be ready for going with the infertility treatment from next month itself. And thank you.